Coming up in this edition of Cogeco News, some more restrictions, some very important restrictions lifted in the present. The mall is open, but not fully open. And another big thank you going out in our community. Hello again, everybody. Welcome to this Friday edition of Cogeco News. I am Greg Estabrooks. At long last, visitors will soon be allowed to see their loved ones at long-term care facilities. Severe restrictions are still going to be in place, though, when those visits occur to reduce the risk of spreading COVID-19. Clark Eipel is outside Castle Home with this important update.
It is certainly hard to overstate the importance of visiting at Castle Home. Thanks to Phase 2 from the province of Ontario slowly reopening the province during this coronavirus pandemic, visiting at long-term care facilities will happen as early as Monday, Castle Home included in that mandate. Now, strict restrictions will be in place to virtually eliminate the possibility of spreading the coronavirus.
The lack of social time is having a detrimental effect on the residents of the long-term care facility on Olive Street.
You know, we're seeing a lot of people losing weight. The family obviously not being able to visit has contributed to that. And I think more so the fact that the social distancing has, put them out of touch with their neighbors even on their same unit. And that is we're really seeing a real impact of that.
When family can come in, I assume some severe protocols will be urged and demanded to make sure that any potential spread of COVID-19 is significantly reduced, if not eliminated.
Well, they have to, one of the parameters which we'll be sending out is they'll have to let us know or a test that they've had a test in the last 2 weeks. And it's obviously been negative. They're only outdoor visits at this time, so what we intend to do is set up a bit of a bistro outside, potentially with double fencing, because often what happens is you have a one fence and you can still reach across. So it'll look more like a licensed bar, because there'll be double fencing and that kind of thing. So,
will you be serving beer?
Of course. That actually funny you should say that, because we did have an alcohol cart to go around, because this is a licensed place, and that was probably the biggest hit we've had is the service of alcohol. But yeah, we're trying to connect people, have lunch. It's a 30-minute minimum, I believe, is one of the parameters. So to have a good, healthy visit. And it should be very, very healthy for everyone.
And for the well-being of the residents here, you can't even vocalize how important that's going to be to see their family again.
It's just family, visitors, that human connection again is going to mean so much for people. And there's certainly been a lot of support from the staff, but nothing like having your family and visitors to come and talk to you is probably the best medicine.
My first case witnessing a test. Here at Castle Home this morning, it takes literally 30 seconds. So once everything's in place, it's really like a factory line. People can come in and come out, and the tests are very quick.
Yeah, and quite honestly, our local hospital, and particularly Dr. Cowan and Tiz, have been so supportive, because, to bring in a kind of resource like that to test 330 people in a morning is incredible. Yeah, but we've got all lined up. We've had the requisitions. We have a drive-through for people. We have a room set up for people who are working today. So yeah, it's pretty slick.
For guidelines surrounding the visits to long-term care facilities, visit ontario.ca. Reporting for Cogeco News, I'm Clark Eipel.
Now to the board for the North Bay Parry Sound District Health Unit. COVID-19 by the numbers. 355 tests done. No more new cases, still just 29 in all out of 8,837 done, 28 resolved, and 1 fatality. Speaking of changes, big changes coming to the way much of Ontario does business and those in business doing business. The long-awaited Stage 2 of Ontario's reopening did not include the whole province or every business, but there are many new avenues available for Ontarians and Ontario business people to explore when it comes to business and social interaction. Nipissing MPP Vic Fideli addressed many of those today.
Well, I think there's a whole menu. First of all, long-term care, retirement homes, and other congregate settings are going to open on Thursday, so you can visit your loved ones. But you need to be tested, so there's lots of time to go to the assessment center in North Bay and get tested. You can't get in without showing a test within the last 2 weeks. So that's an important change. I think another important change that we made this week was the 30-day restriction on prescriptions. That's lifted now, so you can get your 90 days worth of prescriptions. I think a lot of people were concerned about that. With the business community, you see things opening today. I got a haircut today already. You'll see the Digital Main Street. It's a grants of $2,500 per business to have young men and women come in and teach you and your business how to go online. So that's another big program, $7.5 million program from the province. But today we saw the malls open, we saw hairdressing salons open, we see restaurant patios open. So this was a very, very big week in terms of turning our economy around.
But there still is a very large group of naysayers saying with COVID numbers still high, maybe it's too soon to start to reopen.
Two things. Everything is done with the direction from the Chief Medical Officer of Health. So that we've opened in stages. And we've opened in regions. So in Toronto, in the greater Golden Horseshoe, you can't go and get your hair cut today. You can't go to a patio today. So where the Chief Medical Officer of Health felt it was safe, he's given the direction to open. So in 24 areas of Ontario, we're open, and 10 we're not.
One of the areas not open is the Greater Toronto Area, one of the most populous places in all of North America, and the economy's engine for not just this province, for much of Canada. Can there be any kind of recovery before it officially reopens?
With respect to the Toronto and the Golden Horseshoe area, obviously we expect that to open sooner than later with the direction of the Chief Medical Officer of Health. But all manufacturing is open, all construction in Ontario is open. The supply chain is open, trucking, warehouses, distribution, all of those are happening. Retail is open in Toronto, but it really will be the tourism and the restaurant sector. So film is allowed to be open, which is good for our region, but it can't open in Toronto yet. So, you know, there'll be some areas that are going to be most eager to get open and help become part of the recovery.
Nurses across the province, or at least a big number of them, have had enough with COVID-19 making their work even more dangerous than it already is. Thousands of nurses in this province have taken to social media to show their frustration about a pay raise they feel is like a slap in the face. Melissa Candelaria has that story from our Halton Bureau.
For the last 3 months, we just want some consideration for what we've been put through. I'm sorry. It just really hurts.
Moved to tears, registered nurse Laura Holmes is frustrated with the Ontario government over a bill that gave them a raise she says makes her and nurses across the province feel worthless. That bill is Bill 124, which Holmes says controls the pay raises for public employees.
What has ended up happening, though, is, from my perspective, is the only people that have gotten affected by it hard, where the pay raise and the benefits combined are 1%, are the nurses. Our pay raise was, in order to take into consideration the additional costs of the benefits because of the pay raise, they went and dropped our pay raise to 0.938 to make sure that they wouldn't go over the 1% that is identified in this bill that was passed in 2019.
Now with COVID-19, the work nurses have to do has become more dangerous. Motivated to do something, Holmes created the Ontario Nurses for Protest Facebook page that has seen almost 15,000 members join in just 3 days, and with more expected to sign up. Holmes says they are hoping this will inspire the government to make a change.
I understand that the bill was put in before COVID happened, but the government has a clause in there that they can exempt professionals from this bill. And I just think, considering the circumstances of the COVID, what we're doing, the sacrifices we're making, that if there's ever a time where somebody actually deserves to have an exemption to it, I think we've earned it. I get my son in his bedroom. He's 18, so he's older. I take my shoes off at the door. I literally run straight to the laundry, strip down naked, put all my clothes in the washer on hot with bleach. I've got some uniforms that are pretty colors from the bleach. Run upstairs completely naked and go into the shower as hot as I can and scrub down so that I don't end up infecting my son. It's like incredibly stressful right now, and everybody is just trying to do the very best they can, but it's like, that was just, if there was ever anything that felt like a kick in the stomach, a punch in the mouth, that pretty much did it.
Beyond the Facebook page, a protest in front of Queen's Park is in the works for next week. Holmes says they are trying to plan this so they follow social gathering rules and make sure it's done safely.
We're still trying to see if we can make this work, but we're hoping that we can maneuver something so that we can be at Queen's Park or on the sidewalks around Queen's Park, separated with face masks and protective equipment, and be there and just to let the public know that we need your help and we need you to help us get the message through to Doug Ford that, the fact that, nurses have died from this, and we go into work not knowing if we're going to come out sick, and that's kind of worth more than 0.938.
Reporting for Cogeco News, I'm Melissa Candelaria.
Powerful story. Thank you, Melissa, for that. When we come back, the malls are open, but not all the stores in said mall are open. That and more after this. Welcome back, everybody. With just 4 days warning, the Ontario government allowed shopping malls to reopen. However, the restrictions placed on shopping malls are significant. This morning was day one at the Northgate Shopping Centre. It was more of a partial opening at Northgate Shopping Centre on Friday morning, day one of stage 2, as dubbed by the Ontario government. Some stores were open with many safety precautions in place. Some stores were getting ready to open, and some stores look like they're a long way from opening. But the mall is doing the best it can.
It has been a work in progress basically since we closed down. Well, we've been open with our essential services, Walmart and Dollarama and that kind of thing, but definitely preparing the signage, and that was done on a national level. all of our shopping centers, had the same creative developed, all of the distancing signage, but it was really having all that prepared and then installed that did take time, and then all of our new cleaning procedures and that kind of thing, preparing all of that as well. I think all of our retailers are, really excited to reopen. They want to get back to work and that kind of thing. But really, it hasn't left a lot of time for them to prepare their opening, their staffing, their own signage and that kind of thing within their own stores. So that will take a little bit more time. You'll see the stores start to open up bit by bit based on their own organization.
Inside the mall, caution tape is very evident and all kinds of signage related to social distancing and other COVID warnings.
We will be asking people to respect distance. However, we do have security staff in place to ensure that people are not congregating and whatnot. And then also a lot of the stores have their own, counting processes and that kind of thing in place. You'll see some lineups outside of stores, but for the most part, it seems to be very well organized, which is good.
As for this shopper, very glad to be back at Northgate Square, not just for shopping, but for exercise.
It's great relief. We could come and look for books and clothes, and even doing my walking, it helps with it. Number one, it's my exercise. That's what I just told my husband, I'm doing my exercise. I usually walk an hour a day. So today I'm walking in the mall instead of in the cold.
Another pleasing aspect is just interacting with other people.
The friendliness of the people, talking to people, just being around people, it brings up your spirits.
However, this merchant says he's a little concerned about the future of his store, partly because of the short run-up time to reopen and partly because of all the restrictions.
I mean, I've been eager to work because, it's boring at home, but obviously immediate concerns about what precautions has the company taken, what precautions has the mall taken. I'm sure the same thing that everybody's thinking. It's just going to be problematic to reopen. I don't feel like it's going to be busy enough. On a typical weekday, there's usually one, maybe two staff on, and now we have to have two staff all the time, and I don't know, it's just not really busy.
Danielle Galati runs a women's clothing store, which makes things very tricky when it comes to trying on garments.
Right now, we have a limit of one fitting room, so people are able to try things on, but we recommend, keep their clothing on, like underwear if they're trying on bottoms, that kind of thing.
In regards to normal shopping volumes, well, Saturday may be a better gauge of it. It was a little. And Grant also added that to this point, all stores have told her and the mall owners that they plan on reopening. Regional frontline staff were saluted out front of the Nipissing Serenity Hospice on Friday. North Bay Hydro supplied the boom truck and the hospice supplied the signage for a display that was hard to miss if you found yourself on John Street Friday.
North Bay Hydro has teamed up with another local organization to salute the frontline workers on this Friday. Today, the Nipissing Serenity Hospice.
The hospice is fairly new to North Bay in our region, and we have frontline staff here 24 hours a day, and we thought it was important to recognize them in a public forum. And with North Bay Hydro on board, they're happy to string up a sign for us and have the truck here. And it's a windy day, but it's some great recognition for the great work being done here.
How is your staff coping through COVID in terms of heightened pressures on sanitization and PPE wearing?
Yeah, it's definitely, we've been going through a lot of PPE, but the staff here has been great, and they recognize, like staff anywhere else in the city and the province, they recognize what has to be done, and they're coping with it, and they're doing a great job.
Phase 2 of the province reopening is being rolled out as we speak. Long-term care facilities, visiting will be allowed with certain restrictions. Is this affecting the hospice in a positive manner, allowing more visitors?
It is and it isn't. We do have to look at our area and see how things are going. We've had restricted visiting since the beginning. And we're going to just look at the climate of our area and see how that's going to affect us.
Right now, what is the visiting protocol?
Right now, we're allowed, each resident is allowed to see 2 visitors per day, and those visitors are fully screened and they're wearing PPE. So it has been, that's been the case since it started, and we've kind of monitored and adjusted as we went along.
How difficult is that, knowing that people that come to the hospice are in their final days and they want to see as many people as possible? So it's a really tricky situation to be in.
It is difficult, and we do try to accommodate when the passing is imminent, and we've done a great job at that. We don't want to see anyone miss out on those final moments, so we have to adjust per case and, like I say, per the community.
Breakdown has arrived here in Cogeco News. When we come back, the weather, well, let's hope it's going to get a little bit warmer. Clark finds another unusual streak to him, and sadly, he did find his way back to the station. Weather after this.
Weather is brought to you by Canadore College. Great things happen here.
It's beginning to feel a lot like winter out here. Welcome back to Cogeco News. I'm Clark Heipel here. I'll tell you where here is in a moment. More on that in a second. I am here for your 5-day weather forecast brought to you by Canadore College. Also here to strongly suggest that you pick the shade of red of your favorite choosing to show your support for the men and women of the Canadian Armed Forces each and every Friday. Yes, this is episode 9 of Streets You Didn't Know Existed, a very popular series, really taking off. And it's always fun to have people to play along. So during the week, in the late morning, early afternoon hours, I will be doing a live Facebook video, giving a couple hints and asking you to tune in to Cogeco News Live at 5, which we are doing right now, where we'll have the big reveal. So right now, I'm standing on a street 30 to 40 meters long, 2 houses, 1 business, central location. Where could I be? Before I give the answer away, let's just do a 360. There's a house that's on a adjacent street. That's not included. There's the business. And let's turn the other way. I got a mic cable here. Don't want to tangle it up. There's a house, and there's a driveway to that house, and there is, big hint alert coming up, Laurier Woods. I am standing on Winters Street. So yes, feeling like winter on Winters Street. I am not sure how many people will get this one, but if you did, congratulations. Let's take a look at that 5-day forecast as the temperature is going to rise on Saturday and continue to rise into the weekend with sunny skies the rest of the way. Heading overnight on this Friday night, cloudy skies, a cold low of 4, at least it's above freezing, wind gusts 40 kilometers per hour in the evening. Saturday, June 13th, 3 days away from my mom's birthday. It's going to be a nice sunny day. High 17, UV index high. Don't let the cooler temperatures deceive you. Wear SPF 60 on Saturday. On Saturday night, low of 6 with clear skies. Sunday, Monday, Tuesday, sun. On Sunday, sun, high 20, low 9. Monday, 22, and the low will be 12. And Tuesday, guess what? More sun, 24 and 15. Turning the page back to the almanac, we can tell you Thursday was a cool day with lots of wind. 18 and 9 was the high and low. The normal is 21 and 11 for this time of June. There you have it. There is your 5-day weather picture. Do stay tuned. Our Greg Esterbrooks, I'm not going to say anything about it today. We'll have your sportscast right after this.
Sports is brought to you by Tag Construction for all your construction needs.
Couple of quick notes before we go this Friday. Was supposed to be Relay for Life tonight up at the base, but of course it's not happening. There's Sue Plamondon from Days Gone By at the Cancer Society. You can still donate though at cancer.ca. And Hair Today, Gone Tomorrow. Yes, Vic Cadelli channeling his Professor Irwin Corey. Those who know. Yes, you got a haircut today. A lot of people did. That's it for news, weather, and sports. We'll see you Monday live at 5.